Students, now we will be teaching you receptors, general concept, and autonomic nervous system adrenergic nerve endings, just to refresh your previous knowledge. Now, as you know that receptor general concept is very important, especially in pharmacology. So, let we discuss the receptors and its key characteristics. What are receptors? Receptors are macromolecules usually, but not necessarily. This point is important. Proteinic in nature that have specific sites. Usually it is three-dimensional, to which the ligands or the drug attach. This attachment to receptor produces certain physiological as well as pharmacological responses. If it is neurotransmitter and attaches with receptor, so it means that it is going to produce physiological response. And if it is a drug given from the exogenous side, it means now that neurotransmitter will work as a drug and is going to produce the pharmacological response. So it's merely the type depends on the types of terminology. Now, having said that, there are three characteristics of receptors. One is the affinity, the other is specificity, and the third is the intrinsic activity. If a ligand or drug is having these three characteristics, which is having the affinity for receptors, and it is specific for that receptors, and it can mimic or stimulate or activate the intrinsic activity, which is the inbuilt activity of a particular receptor, then we can say that this particular ligand is an agonist. Now it will be clear once we move forward. So thus, for receptors have three key characteristics: affinity, specificity, and intrinsic activity. Now, to understand that concept, I have drawn here some diagrammatic representation. This is lock A, and it is having a specific key, which is with a particular notch you see here, and it is named as key A for lock A. Here is key B with a single notch you see for lock B, and once you put respective keys in these respective locks, so it opens. You know the purpose of this key. The key is to open the lock. So key A will open lock A and key B will open lock B. Why? Because it is specific for its specific locks. So the keys are specific for specific locks at the time of purchase that you have. And if you mix certain keys with different locks, and that is by chance or unintentionally, so sometimes you put one key in the other lock and the lock is sometime opening and it is not opening, you see. So the keys, respective keys, open the respective locks, meaning that there is specificity, affinity, and intrinsic activity. And intrinsic activity of the key is going to open the lock. Now for understanding, you see, now I just change sometime this lock, the key B, key of lock B is now put it on lock A. So sometime it is inserted, and once you turn it around, sometime it opens. So now here this is the key of another lock, that is lock B, and is going to open other lock, that is lock A, which is by chance, and this by chance opening will lead to by chance. Once the drug is used for one purpose and you administer this, it is going to involve the receptors, so it may go and involve the other receptors, and thus by chance you may come across with some other unwanted effects of drugs as well. So thus sometime by chance you can find an agonistic activity. Now I am carrying you to another situation when there is a key B of lock B is being placed on lock C. So now you see this key B is inserted there. Okay, so it's maybe though it's not specific, but it has been accepted. So mean it's just like an affinity case. Now uh, when you turn around sometime, the key turn around and you are very happy that the lock is going to open, but the result is that the lock is not open. Now this is a classical example of an antagonist. So if we apply this model to a particular receptor, and there is alpha 1 receptors and there is beta receptors, you see, and same is the same locks are here, it is reflected, and you take a drug that is norepinephrine. So norepinephrine can mimic the activity of alpha receptor and beta receptor. So this is a classical example of this, that and you know not the importance of norepinephrine. Hence norepinephrine is an agonist and it can act on two different receptors as well. Now this model is classical antagonist model. So it is important to know the intrinsic activity, and the intrinsic activity is the purpose or nature of a receptor for which it is built in. And this concept is very important for targeting a pharmacological response or avoiding a possible adverse drug reaction or side effects once you are going to administer drugs to your patients. Now we move on. So we use the terminology agonist and antagonist. Now correlating these key characteristics with these lock models, you see. So we use the word antagonist and we use the word agonist. So what constitutes agonist and what is an antagonist? So the key characteristic of an agonist is it must have an affinity, it must have a specificity, and it must have an intrinsic activity. Now there can be certain drugs or ligands which may have affinity for receptors, may have a specificity for receptors, but have no intrinsic activity, cannot perform the purpose of that receptor for which it is built in. If this is the receptor and this is the neurotransmitter type 1, this is neurotransmitter type 2, and this is neurotransmitter type 3. So you see this is round circle neurotransmitter. It can be put here in this cylindrical shape. So now it is specific for this particular receptor, but not specific for this one or this one. If the inclination of this and this is toward receptor, so the more inclination, the more will be the affinity. So now I hope you understand agonist and antagonist. Now since we are using the word receptors, so what are types of receptors in general connotation? There may be nociceptors that relate to the pain, and then the thermoreceptors relate to the temperatures, and mechanoreceptors related to the touch and sensation, and chemoreceptors that is related to the chemicals or changes in the biochemistry of the body. And you see classical examples of chemoreceptor trigger zone that is going to send sometime an epistatic stimulator that can produce nausea and sometimes vomiting. Now receptor types and neurotransmitters, you see. So this classification can be based on the neurotransmitter as well. So if the type of receptor is cholinergic, so it is going to have acetylcholine, the neurotransmitter. In case of adrenergic, the neurotransmitter is adrenaline and noradrenaline. In case of dopaminergic, there is the neurotransmitter is dopamine. So that for serotonergic nerve, there is serotonin. For histaminergic nerve, there is histamine. And of course, for GABA receptors, the neurotransmitter is GABA. But you see, these three are very important in the autonomic nervous system. Autonomic nervous system means the system that is automatically controlled. Its norms, auto means self, norms. Nomic mean related to norms. So its norms, its activities are self-regulated. That is called autonomic nervous system. So acetylcholine, noradrenaline, and dopamine are the main neurotransmitter of the autonomic nervous system, whether that is parasympathetic division or the sympathetic division of the autonomic nervous system. Uh, Chemical signaling between the cells, whether that is nerve cells or muscle cells. So for that, I would urge you to go to see first, go through our video that is on depolarization, repolarization, and hyperpolarization, available on this link. So that will make your concept very easy, because then you can understand the events happening at the level of adrenergic nerve endings. Now, what are the steps involved in the signaling pathway? Because we know nerve function is to transfer information from one place to other, and this transferring of signals sometimes is very complicated. But nevertheless, since I'm focusing on the beginners, so you see the steps, that is the local mediators are released, and the example is autokines. Auto means self, kine means limiting. So these are self-limiting substances. It doesn't reach the blood. It is synthesized in the region where it is required. For example, there is a full-term pregnancy, and once this full-term pregnancy and the process of parturition is about to be started, so there is release of certain prostaglandins, that is PGF2 alpha, and that is responsible for the uterine contraction. Like histamine is also an autokines, and so many other substances like 5-hydroxytryptamine, bradykinin, and slow releasing substances of anaphylactic shock. So these are all local mediators. You see, the information may be passed on through the hormones. Hormones are from harmony, as the name represents. Hormones are from the word harmony, and harmony means peace and tranquility. So these hormones bring peace and tranquility inside the body of the living being. And how it is going to bring peace and tranquility? Because it's going to maintain the normal physiological function. If the level of hormone is either low or high, so it can create problem. For example, the cortisol level is low, this is called Addison disease, and if it is high, it is called Cushing syndrome. So hormones signals have been passed on to the hormones, so they are secreted directly into the blood, and thus it produces and regulates the normal body function. There may be a release of neurotransmitters, and the release of neurotransmitter, like in case of adrenergic nervous system, is noradrenaline, and for the inhibitory neuron at the level of central nervous system, that is GABA, and for the excitatory, there may be noradrenaline at the level of central nervous system as well. Now, secondary messenger system is very important, because once the neurotransmitter comes and attached with the receptor, so the secondary messenger system is sometimes activated. It is not almost all the time involved, but it is an important component. So thus a cascade of events has been occurring, and that is to translate the message, like adrenaline cyclase and calcium phosphoinositide system that is there. So they are the classical example of secondary messenger system. I have simplified in this slide the secondary messenger system for you people. Like, these are receptors coupled to ion channels, and this is receptor coupled to adrenaline cyclase, and this is receptors coupled to diacylglycerol and inositol triphosphate. So what happens when neurotransmitter comes and attach with these receptors, and if it is ion coupled channel, you see receptors. So what happens? The ions then goes inside the cells, and the classical example of this type receptor is GABA receptors, where the GABA receptors is once receiving the neurotransmitter GABA here, so the chloride ion channels opens, the chloride goes inside, and there is the interior of the nerve is then more negatively charged, it is hyperpolarized, and thus changes in the membrane potential occurs. Regarding receptor coupled with the adenylyl cyclase system, you see, so if it is stimulated, then what happens? This neurotransmitter comes and attach with the receptors and then activates, having a positive effect on the adenylyl cyclase system, and the ATP is converted into cyclic AMP. Consequently, the protein phosphorylation happens here in the cytosolic level, and this lead to intracellular response. Same is true here for this other neurotransmitter will come and attach with the receptors. In case of diacylglycerol, so phosphoinositides are converted into inositol triphosphate and diacylglycerol, and this leads to release of calcium from the internal stool, and consequently all these receptors, you see, the intracellular response is increased or regulated. So this was about secondary messenger system. I'm using this adrenergic ending to refresh your knowledge, as I have posted this in autonomic nervous system pharmacology lecture 1. So just to add a few things, tyrosine is taken into the nerve ending. This is synapse, this is presynaptic nerve ending, this is postsynaptic nerve ending, and this is blood, and in the blood there is tyrosine as a amino acid. Once it is crossing the blood-brain barrier, and you know what is the blood-brain barrier, I have made it 3 different barriers, and you understand that while recalling your anatomy knowledge. So the tyrosine is now in the extracellular fluid, and this tyrosine is through the active transport being taken into the interior of the adrenergic neuron. So L-tyrosine is then converted into dopa, dopa is converted into dopamine, and it is converted into norepinephrine, and then it is stored in the vesicles. Now, when there is an impulse or stimuli of enough amplitude to depolarize this nerve, remember the concept of depolarization, repolarization, and hyperpolarization will always be there. So please go through that video. Now, once a certain stimuli reaches here, like calcium is influxes inside, you see, and this lead to the fusion of these vesicles, and the free norepinephrine is then released into this synapse through the exocytosis phenomena, you see, and then this neurotransmitter is going to attach with different receptor. There may be alpha 1 receptor, there may be beta receptor, and there may be alpha 2 receptor. Remember, the alpha 2 receptor are also present in the presynaptic nerve ending, and these are inhibitory in nature, as they are coupled with the ligand protein, inhibitory protein G, you see. So its function is to regulate, having a negative impact on the release of exocytosis. Now this norepinephrine has to be regulated. The level of norepinephrine has to be regulated in the synapse. So God is the biggest scientist. He has produced this catechol O methyl transferase. Catechol O, the structure of this is catechol ring, having cortical ring, this norepinephrine and epinephrine. So norepinephrine is being a catechol, so it is catechol O methyl transferase, and it is then converted into the norepinephrine is converted into inactive metabolites. On the other hand, there is a reuptake 1, and it is going to carry this norepinephrine into the nerve endings, presynaptic nerve endings. There is an enzyme, monoamine oxidase, and this monoamine oxidase will then inactivate this pre-norepinephrine if its level is high. But if you stop this, inhibit this enzyme, I have used this cross, you see, then what will happen? The level of norepinephrine will rise, and once the level of norepinephrine rises, so the concentration, then it promotes the rate of forward reaction, and that is release of norepinephrine into the synapse. And in case of depression, the level of bioamine is decreased, and though we are now in peripheral nervous system, but the same concept applies to the central nervous system as well. So in case of depression, if we either block this reuptake So here the level of norepinephrine in the synapse rises, or we inhibit this monoamine oxidase enzyme. So again, indirectly the level of norepinephrine rises. So thus, tricyclic antidepressants, which are inhibiting this reuptake one, are 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 are, are you can say antidepressant. Reuptake 1 inhibition will also lead to, in the autonomic region of nervous system, peripheral nervous system, a sympathomimetic-like activity, because this will promote rate of forward reaction. And when promoting this rate of forward reaction will lead to increase in the beta 1 receptor response and the alpha 1 receptor response, which is it's converting phosphoanisotires into anisotol triphosphate and diacylglycerol. So intracellular calcium level will be raised and there will be protein phosphorylation, as we did discuss in the previous slide. Now, what is the message? The message is that if we increase the level, this norepinephrine is coming here and attaching with presynaptic alpha 2 receptor, so it will going to inhibit this, and the entry of calcium is now stopped inside the cell. So the release of norepinephrine into the synapse is also decreased, because it is having inhibitory protein coupled receptor. It is an inhibitory protein coupled receptor, and thus it is going to regulate the release of norepinephrine into the synapse. Other important point is that if you are going to attach or this norepinephrine is going to attach with alpha 1 receptors, as I said, so the anisotol triphosphate and diacylglycerol synthesis is increased, cytosolic calcium will be increased, it will then produce phosphorylation of protein and cellular response. But phosphokinase C is also, once this response is high, then it is going to have a negative impact on the potassium efflux, so it's going to regulate this function as well. Alpha 2 receptors at the level of postsynaptic nerve ending will have an inhibitory attack on the inhibitory action on the adrenergic cyclase, just to regulate the function of this beta receptor. So there is always a regulatory mechanism that does exist. If norepinephrine comes and attach with beta receptors and going to have a positive effect on adrenergic cyclase and cyclic AMP level rises, so the alpha binding of alpha 2 receptors with norepinephrine will have an inhibitory effect, or a controlling effect rather, on the adrenergic cyclase system. This is important for understanding. Beside that, there are parasympathetic nerve endings as well, which I have not shown here. So because that will make for you the system more complicated, and I do not want to make it complicated right now. So what happens now? We can play with different this, like if monoamine oxidase inhibitors are given, so they will work as antidepressant. Then if we give beta blockers, so that will come and directly replace this norepinephrine and attach with this beta blocker, so the result will be totally opposite. So this model is very strong now, and beta blocker will produce asymptomatic activity. So what is a nutshell message? That this model is very important for antidepressant drugs, antihypertensive drugs, and the drugs that are going to use for the management of vital organ function like heart and the blood vessels. I hope now you understand that. Thank you.